This is Dr. David Oster, and this is a presentation that I put together discussing ankle sprains. This is the third part in a 4-part series. This part discusses strengthening exercises. This video was produced by myself, Dr. David Oster, at Denver-Vail Orthopedics, in conjunction with Dennis Martin and Wes Riggs, physical therapists at Proactive Physical Therapy. In review, Part 1 discussed the mechanism of injury of ankle sprains, basically how they occur. It discussed what ligaments are commonly injured. And lastly, it reviewed the initial treatment for ankle sprains, which includes rest, ice, compression, and elevation. The second part discussed stretching exercises to improve range of motion, both isometric exercises. This third part, as well as strengthening exercises that can be used to improve the strength after an ankle sprain. Exercises include both calf raises as well as TheraBand exercises. TheraBand is a rubber band that can be obtained at either a sporting goods store or can be obtained online through the internet. These strengthening exercises should not be performed until a person is weight-bearing and their range of motion has improved close to normal and the swelling has improved as well. The following videos are examples of strengthening exercises that are to be used following an ankle sprain.
The progression to strengthen the back of the calf, we usually like to start a patient with handhold assist so that they're in good balance, so finger touch on a countertop, both feet down, and he's just going to stand up on his tippy toes and then back down with a feather touch and back up. I always encourage patients, this can be done relatively early in the rehab process once the range of motion is improved and people are ready for this. So once the range of motion is improved, people are walking pretty normally. Double leg heel raises are very appropriate. A more advanced progression is obviously standing on the injured ankle and doing single leg heel raises. Again, going to be more advanced. Some patients may not be able to do this from a strength perspective prior to their injury and certainly wouldn't be appropriate after their injury. It just depends on their functional ability. Reps and sets are going to vary depending on the patient's strength and tolerance. So I would start definitely with both feet on the ground and move forward after the exercise becomes too easy. When an ankle is healed to the point, most people are starting to walk at this point without a limp. Their range of motion is certainly more near normal. They may have some subtle stiffness, but they're walking without a limp. Their swelling's quite reduced and their pain and comfort is drastically improved. You can start with some gentle ankle exercises as you can work through a more normal range. The most common is a TheraBand exercise that a patient can do on their own at home. This is standard TheraBand. You can go to any sporting goods store and get a sports cord or something of its kind. And what you want to do is apply this in a loop fashion to the end of the foot, and you want to try to get and cover the toes as well. And Wes is just going to bring tension against the TheraBand by pulling the cord obviously closer to him. And then he's going to point his foot, again, working on curling the toes on the way down and extending them on the way back. So his resistance is going to be when he points or plantar flexes his foot. This will work, obviously, the muscle in the back of the calf. Reps and sets vary dependent on the patient's strength and ability to function with their injury. Start with gentle ranges of motion. Again, it shouldn't be painful. It should be relatively pain-free. You can start anywhere from 5 to 20 reps depending on what the patient's ability may be. The next one, if you have a spouse or child or friend or somebody, or even tying the end of the band to a table leg, he can work the opposite motion, which would be pulling his foot up or dorsiflexing his foot against resistance. You want to make sure the resistance isn't great enough so that he can't complete the range of motion, but certainly enough to where he feels resistance throughout the entire range of motion. Reps and sets again will vary depending on a person's ability to function. Working away from the straight plane of up and down, we'll have Wes bring his leg up. He'll wrap the cord around his uninjured leg, pulling tension and spreading his legs apart slightly and letting his foot drop into actually the position that he injured his ankle. So the starting position will be into what we call an inward ankle or an inverted ankle. Again, this is the position that people commonly hurt themselves. And then taking his little toe up and out, and then controlling the resistance back down to its starting point. Working through his entire range of motion. This is one of the most important exercises in terms of preventing further ankle sprains, because it works the muscle group to the outside of the shin, which helps control the rate of which a person runs into this position. So when you get into those compromised positions with sports or any activities or altered surfaces, these muscles will pull the ankle out of that precarious position. The final one is the more challenging one, but easy enough to do. Wes will cross his leg. Again, the band should cover the forefoot and the toes as well. He'll spread his legs apart, pull with his hand, and his starting position will be up and out. And then he'll work down and in. Big toe will come down and in towards me. Curling the toes on the way down, letting the toes straighten on the way up. Pace with this exercise early on may be a little bit slow and with some caution. As his strength and range of motion increases, I do encourage patients to go at a more rapid pace, so they really try to work into a fatigue state. So as the level of function, range of motion, and pain, all improve, speed and reps should increase.
So those videos presented exercises to be done following an ankle sprain. These exercises should be done when the swelling and pain improves and as the range of motion improves towards normal. This video was produced by Dr. David Oster at Denver-Vail Orthopedics in conjunction with Dennis Martin and Wes Riggs, physical therapists at Proactive Physical Therapy. If you'd like to look at other text or video concerning orthopedic disorders, please visit my website, davidostermd.com, for an office appointment or evaluation, 303-214-4500. Thank you.